When we talk about the uterus, which is the organ that, is also known as the womb, where a pregnancy is carried, it's made up of two types of tissue. One is muscle, and it's smooth muscle, not like the muscles in your arms or your legs. It is a type of muscle that can stretch and expand. So if the uterus is carrying a pregnancy, it can go from being the size of a pear to being the size of a watermelon, right? So that muscle tissue can give rise to cancers, but the more common type of cancer of the uterus comes from the lining of the uterus, which is what is present in order to support a pregnancy. And when a pregnancy doesn't happen, the lining is what is expelled or shed from the woman's body. So when you have your period, you're expelling or shedding your uterine lining, which then regenerates in a cyclical fashion. So the most common type of cancer that women can get in the United States and really almost also worldwide is cancer of the lining of the uterus. It's also called endometrial cancer. There's a third type of cancer that technically is a cancer of the uterus, and that's cervical cancer, because the cervix is what the opening to the uterus is called. It's part of the uterus. It's not a separate organ. It's made up of the same smooth muscle. The cervix, which the normal opening of the cervix is probably, about the size of a grain of rice, has to stretch to 10 whole centimeters, big enough for a baby's head to fit through. Mm-hmm. So there's a separate type of cancer called cervical cancer, which women can get, which is actually the most common type of GYN cancer worldwide.